bowel cancer surgery, there's really options going forward, and robotic surgery is one of the newer techniques for treating bowel cancer surgically. And so anyone who has a bowel cancer will have a lot of investigation and different modes of investigation to look into that. And that normally will involve a colonoscopy and some special scans with a CT scan or potentially an MRI scan. And then looking at exactly what's going on. And one of the components, and a large component of treating bowel cancer, does involve surgery. Now, over the years, surgery can be performed very safely by an open way, laparoscopically or keyhole surgery, and more recently, robotic surgery has been used. And to be fair, in this country, in certain units, it's been around for quite some time. One of the advantages of robotic surgery is using the most up-to-date and modern technology that we have, and the aid of having a robot to assist with the surgery means that surgery becomes phenomenally precise. The optical views we can obtain are in 3 dimensions. The equipment we can use and the ways of controlling them allow much more precision around major blood vessels. It means that the surgery is very, very precise, and means that we can control what we're doing in a better way. It means that we're much happier, that we can hopefully remove all aspects of the tumor and its surrounding blood supply, that we can perform connections and joins between bits of bowel in a very precise way. And we hope very much that provides a cosmetically very good result as well, by the techniques that we can perform as well when we remove sections of bowel from the body. So robotic surgery is something that is becoming more common, being used by more centres, and with an aim to improving outcomes from bowel cancer surgery. I would say that I think robotic surgery is one of the safest forms of surgery that we can possibly perform. It's using the most modern technology that we have. The training programs that all staff go through, be it the theatre staff, the nursing staff, or the surgeons, go through a very rigorous training course for this. And to be fair, most of the surgeons going through this will be quite used with minimally invasive laparoscopic surgery and are very used to using those sorts of techniques. But it's a technique where there's a lot of quality assurance and reflection on the techniques used, a lot of video recordings and observation of that, and results from the surgery is analysed in great detail, because it's very easy to collect the results from the surgery itself. So I would say it's one of the safest techniques for surgery there is. With bowel cancer surgery, is it's effective? I think the evidence for robotic surgery is extremely good. If I think of my own practice and having performed laparoscopic surgery for bowel cancer, really approaching 20 years now, and having performed robotic surgery for the last couple, I can compare performing the 2 approaches, and I know my choice is now very much to perform a robotic technique, because I believe it's a safer technique, allowing more control for the surgeon, and I also believe better outcomes. The main risks of robotic surgery are very much along the lines of all major surgery. And so with bowel cancer surgery, the main risk that we probably face is, if we imagine it like a little bit of plumbing where we've removed a bit and then joined bits back together, potentially if the body doesn't heal well, that little bit could leak and cause problems that we have to deal with. But overall, I think it's a very safe approach for surgery, and I think when I compare between the 2, because it's so precise and we have better views, we do find that we find recovery is slightly quicker, we find the pain control is better, and it normally means people are getting back on their feet and back to normal life more quickly as well. Robotic surgery is, if we look across the country, quite a new technique, although some units have been using it for quite some time. And so it's an area of continued research comparing outcomes between open, laparoscopic or robotic surgery. I think one of the things to say is every person's an individual, and we're really reviewing all scans and imaging to work out the very best way, be it combining surgery or chemotherapy, and some people radiotherapy, to ensure the best individual treatment for that patient. Now, where it's available, I personally feel, having performed all these techniques, open, laparoscopic or robotic, it would be without doubt my preferred choice. I do believe it gives the best options and the best opportunity for safe surgery, minimally invasive surgery, and a quick return to normal activities. And so it's something we would talk through. But as I say, it's one of the components of surgical options, and I think it's very important we talk through options when we go through the discussion. Rule, most people would only have one robotic operation performed. In some people, depending on the site of where the cancer is, and often if it's deep down in the pelvis involving the rectum, that the main operation, removing that, will be performed robotically. Now, some people, because of the risk of where we join things back together and potentially not healing straight away, we do talk through using stomas or bags on the tummy surface to divert the stool away while everything's having a chance to heal. Now, if that is the case, we do ensure that that area we've joined back together inside the body is healed well, and we're happy it's back in continuity safely. And then that would then mean a further operation to reverse maybe a temporary stoma. Now, that stoma itself, when we do that operation isn't a robotic operation because it doesn't need to be. So as a rule, most people would only have one robotic operation performed for their actual bowel cancer surgery. Potentially, if someone's had an operation in the past and there's another area which needs further surgery, maybe even years down the road, then again, we would go through the options regarding best treatment there, and potentially a second robotic operation may be considered then. But as a rule, for most people, the actual robotic component is normally just one time.